Welcome back. The American Academy of Dermatology predicts that 1 in 5 Americans will develop skin cancer. And while most are diagnosed in their 40s and 50s, a growing number of cases are in younger patients because of the increased usage of tanning beds. So as we observe UV Safety Awareness Month, we are joined by Dr. Sarah Schwertner from Primary Care Plus with more on how to prevent and detect skin cancer. Good morning. How are you?
Great. Thanks for having me on the show this morning.
Oh, absolutely. This is very important. I enjoy this, especially with my fair complexion. Always good to have some extra tips. So what are the risk factors for skin cancer?
There are several different risk factors for developing skin cancer. Some of these risks can be avoidable, such as excessive exposure to the sun, living in high altitude or sunny climates, sunburns, and also being exposed to toxic substances on the skin like arsenic. However, there are unavoidable risks such as having fair skin, like you said, as far as having moles or precancerous lesions, having a history of skin cancer in the past, as well as increasing age or a weakened immune system.
All right, let's talk about the different types of skin cancer. Or are there different types of skin cancer, or is it just one thing?
There are different types. The two categories are non-melanoma and melanoma. In the non-melanoma category, some examples are basal cell carcinoma, squamous cell carcinoma. These types, they progress slowly, and they are curable cancers if discovered early on. The other category, melanoma, can sometimes be deadly, also can progress quickly and spread to other organs of the body, and it can be found in dark pigmented skin lesions, in moles or birthmarks. Although that it is highly detectable, it is sometimes difficult to treat. It can be caused by sunburns, and also one blistering sunburn in childhood can double the risk of developing melanoma as an adult.
Wow, that's pretty incredible to think about there. It really gives you, kind of some more encouragement to make sure that your kids are protected from the sun if they're out at the beach or whatnot. How can viewers at home check to see if maybe they have the warning signs of skin cancer?
So we like to use the ABCDE acronym to detect melanoma. A is for asymmetry. So you want to look at a skin lesion that is different shaped on each side of it. B is for border. So looking at a mole with jagged, irregular, or poorly defined borders. C is for color. So there can be a significant different coloring pattern in a mole, such as different shades of tan, brown, black, red, white, and even blue. D is for diameter. If you have a lesion that is bigger than the eraser on a pencil, you want to get that checked out. And E is for evolving. So if there is a mole that has changed in color, size, or shape, that is important to get checked.
All right, yes. No, go ahead. Go ahead.
I was going to say most moles are benign. However, the ones that you are born with or develop after 20 years of age, you should have frequent checkups.
All right, so that's a good chance to go and get out to the dermatologist. Lastly, before I let you go here, put sunscreen on, right? You're telling everyone, put sunscreen on if you're outside, especially if you're going to the beach, right?
Right. Make sure it's SPF 30 or above.
There you go. All right, some great tips. Thank you so much for joining us this morning. We certainly appreciate it. Make sure that you are protected during UV Awareness Month. Thank you so much for joining us.
Thanks for having me.